So my name is Caroline Sevoz Couche, and I am a French researcher from Inserm. And I usually work in Paris at the hospital Pitié-Salpêtrière. And I work basically in the cardiorespiratory field. And essentially, I worked for many years on the autonomic nervous system and the cardiorespiratory abnormalities due to stress. So I worked for many years on different animal models of stress. And recently I moved on to work on clinical studies on different respiratory diseases such as the obstructive sleep apnea, for example. So my main research is really based on the vagus nerve. And so the vagus nerve is a nerve with fibers going in two directions. First direction is from the vessels to the brain. And then the other direction is from the brain to the heart and to different organs. And these vagus nerve is absolutely essential for the organism. And what I really look at is the reduction of these vagus nerve activity in different disease, and especially during stress, but also on disease with inflammation or this kind of things. So what I'm doing here is really a new approach and a new therapeutic target for asthma, because the vagus nerve is involved in cardiac regulation because of the direction from the brain to the heart. But it is also involved in inflammation because of the direction from the vessel or the organism, the organs to the brain. And actually recently it has been discovered that activating this vagus nerve can have very good anti-inflammatory effects in different disease, and for example in acute inflammation or sepsis or gastrointestinal inflammation. And because I am involved in respiratory disease, I essentially looked at another disease that is asthma, chronic asthma, allergic asthma, because there is a huge inflammation in the lungs, of course. And so my primary intention was to come here in a lab working on asthma, because they have very good animal models that they developed in the recent years. And then to look at the possibility that in a mice model, we can actually stimulate the vagus nerve to have anti-inflammatory effects. So we look at the inflammatory markers in the lungs. So I have developed this technique because it wasn't at all in this lab. So this lab is at the National University Hospital and the National University of Singapore, the NUS, in the Department of Pharmacology. And then I worked there for a year, and I will stay another year to finish this project. We have received a grant for this project, and we have developed the possibility to really stimulate this very fine nerve in this model, because before that they have tried different antioxidant drugs, these kind of things, but never used this stimulation of the nerve. So this is really my application there. And what we really want to see if this can work, and this can work, because we have very good results at the moment. then maybe there is a possibility that at longer term, we can stimulate the vagus nerve with a transcutaneous gamma core apparel. So this is a stimulation directly there without invasive surgery to stimulate the vagus nerve for asthmatic patients, to reduce their inflammation and to reduce the exacerbation of this disease. So this is my project plan here. And what is really good is that we have a very good technical and scientific environment here in Singapore, because we have very good institution with the NUS, NTU, A-STAR, and so on. So we can have the collaboration of many people, and so we can ask many questions about this possibility and with the immunological research. So this is one part of my research. Another part of my research is on human and clinical trials. And because I am really involved recently in the cardiac coherence or the deep breathing, and this is actually a natural way to stimulate the vagus nerve with the respiration. So this respiration is 6 per minute. So we have a cycle of 10 seconds, and we have 5 seconds inspiration followed by 5-second expiration without blockade between the two. And if you breathe at this frequency exactly, because there are scientific reasons for that, but you actually stimulate ideally the vagus nerve, and then you have very good beneficial effects on the heart, but also on the gastrointestinal motility, or with also the inflammation. And you can also have, because of this vagus nerve going as a loop from the heart to the brain, you have also central effects, and you can have very good effects on mood disorders and also memory and cognitive deficits. So I'm trying here in Singapore, because they are really keen here to learn more about this new interventional technique that is kind of parallel and complementary to Chinese techniques. And so I'm trying to begin a new projects here to see if the chronic practice of the deep breathing can have beneficial effects on older people or with people with diabetes, for example. So this is why it's good to work here in Singapore, because all the clinicians are really open to this new intervention, a part of animal models also. So this is a collaboration between Inserm, because I'm a researcher from Inserm, and NUS, and also NTU and Duke Hospital also for all these research. And finally, what I can say about the COVID-19 effects on my work is that, of course, last year was kind of a disaster for the animal models, because we couldn't order any animals, so we couldn't make any experiments for 8 months. And so that was really, really hard for the project on asthma. But unfortunately, as I had also human trials, I could still have Zoom meetings. And so one of the positive effect here on these diseases that really opens the possibility of contacting people by Zoom meeting to talk about this possibility of working on the deep breathing. And so I have many contacts now in different institutions, because of this new possibility to directly talk to people even not face to face, but through the virtual possibility. And of course, I work a lot from home. And so that also changed a lot of with the social relationships and things like that. But now we have a compromise of maybe staying a bit more home. So because we have a lot of things that we can do through the computer, and also going to the lab when we have experiments to do and see with the students. And talking about these new possibilities, I'm not working from home now. I'm working from a hotel because I am doing my SHN, and so it's very useful to be able to be on a computer and to speak to you through the computer, even when I'm doing it here and my SHN, and I can't go out, of course. And this is also another way that I can use the deep breathing, because then the deep breathing can help you to be calm and relax, and you can go through these quarantine very easily. Thank you very much.